William is 3 and very sweet. He's a lover of numbers. He also loves alphabet, and Paw Patrol is a big one right now. You want a little tickle? Think that will make you smile a little bit?
Tickle, tickle! Tickle, tickle!
He's bubbly and he likes to talk and he likes to work with numbers and he likes to sing and he likes to dance. He's got a great older brother that plays with him pretty much all day.
We went for an ultrasound in Inverness, our local hospital, and they were going to send us to get better ultrasound at the IWK.
We knew something was up, we could feel it, but we didn't know what we were in store for when we arrived at the IWK.
We discovered there was a problem with William's heart.
There was, 4 issues with his heart happening simultaneously. We knew of the heart issues, but we didn't know what we were going to be up against when he was born. And when he was born, there were many other issues.
It's called Hirschsprung's disease. It's basically a congenital problem of the large intestine. Essentially, the nerves on the wall of the bowel are absent. And because of that, the rectum is simply contracted all the time. It doesn't relax. He had multiple surgeries, so including open heart surgery, airway surgery where he had a trach or a tube to be able to breathe through his neck, and then he had abdominal surgery.
When your baby is so small, it's hard to wrap your head around.
Timeline is hazy because we were immersed in this situation for 4 months intensely. I think he had maybe 10 or 12 surgeries in the first year of life. Yeah.
I can't say enough good things about the IWK, really.
We were able to be a family, even though we were living in a very critical situation with one child.
I mean, we had been at the IWK so long that the nurses had set up dressers in our room and toy boxes and all of those things.
Ewan was there too, and Ewan was you're dealing with a 2-year-old making dinosaur noises in the middle of doctors and nurses, and they were so accommodating, and actually he was kind of becoming a little bit famous on the floor because of his personality.
What about him? Who's he? You never said who he was.
William's Luke.
He's Luke? He's not Grogu. I thought you were going to call him Grogu.
I think we need to understand that these journeys they're difficult. They're very difficult for a family to go through all that. And then my take on that is that it's a partnership that you have with the family.
They were always very good at kind of looking for our input. I took that for granted, but that's such an amazing thing.
Because we're so close to William, we're watching him every second of the day. We're the first to pick up on a lot of things, and we kind of worked more as a team through some difficult situations.
After 4 months when we came home, we had a special complex care coordinator between the IWK and the local community.
We serve a very large community that's widespread.
We are 4 hours away from the IWK, so that's pretty far away, but we still feel like they're within reach.
This is one of those problems that it's not like you have your surgery and you're done, off you go, normal life. Especially in the early years, like the first few years of life, usually these patients will have a lot of, we call functional problems.
The IWK basically gave us all the education we needed, all the supports, the equipment, the materials, the contacts that we needed to deal with life going forward with William.
Chili.
It's meat.
It's meat, you're right.
These families, I tell them, nobody knows about this disease more than you do, because I have the knowledge about the condition, but I don't have the knowledge about living with the condition.
No.
Patients like this, I think the best way to put it is, it takes a village, right? Highly specialized, multidisciplinary teams, equipment, intensive care unit. It's very hard to care for these types of patients without, adequate resources.
The telethon is so important for so many kids like William. I can't say enough good things about the IWK, really. If it weren't for them, we wouldn't have William with us.
So many kids have history with IWK. So many families do. So I think there's no better place to put your money.